name's Isabel. I'm an LPN student at Bates Technical College, and today I'll be performing a straight catheter. First, I'd locate the patient's identity, look up the protocol for straight catheters per my facility, and gather my necessary equipment, and then I would enter the patient's room. Hello, Mr. Jones. How are you doing today? Great. My name's Isabel. I'm going to be your LPN. I'm going to be performing a straight catheter today. Have you ever had one of those? You have? Okay, perfect. So you're familiar with it? Great. Let me get my gloves on. Alright, obtain patient privacy. Make sure the patient's in a safe position. And are you comfortable? Perfect. Alright, and then can you just let me know your first and last name as well as date of birth? And I'll check that with your bracelet. Perfect, that matches. Thank you. Alright. So first I'm going to provide some peri-care before I insert the catheter. I'm just going to go ahead and position you, lean back a little. Alright, Ms. Jones, and I'm just going to help bend your knees here. So next I'm going to be looking at my catheter. There we go. Alright, I'm going to go ahead and grab my wet washcloth. Alright, I'm just going to put this gown back a little and provide peri-care, wiping down. Discard that in the dirty linens and get a dry washcloth to dry you off.
And then I will lift her, they will lift her hips.
Alright, I'm now going to open up my kit.
Good job. Thank you for looking at
And just going to grab before I grab into that, I'm actually going to take off these gloves and put clean ones on. Perform hand hygiene. And put clean gloves on before I touch my inside my sterile field. And I'm just going to grab this by the 1-inch border and place it underneath the patient. And Ms. Jones, could you please lift your hips a little for me? Perfect, thank you. Alright, now I am going to put on my sterile gloves. I want to take these off. Perform hand hygiene. And on my sterile. I'm going to move my bucket out of the way. I'm going to pinch, step back. And then use my fingers to hook inside this glove, step back. Alright, now that I have my sterile gloves on, I can go ahead and take my other drape, again only pinching by the 1-inch borders and opening that up. I'm going to drape this over my patient. And then I'm going to grab my box and bring it a bit closer.
And I want to make sure that they have their.
There we go. Alright, Miss Jones, I'm now going to go ahead and clean you up. I'm going to open my Q-tips. Set those there and lubricate my catheter so it's ready when I'm ready to insert it. Discard that. Okay. Now I'm going to grab my Q-tips, open them all out, discard this, and I'm just going to go ahead and set these right in here so I can put my hand down and separate the labia with my fingers. Now that the labia is separated, I'm going to go ahead and grab my first Q-tip and clean, going down and discarding that in the garbage. Taking my other Q-tip, going down on the side closest to me and discarding that in the garbage. And then grabbing the last one and going straight down the middle and discarding that in the garbage. Now without moving my hand, I'm going to grab the catheter 3 to 4 inches from the tip. Alright, are you ready, Miss Jones? Alright, go ahead and take a deep breath in and then a slow breath out. As you're breathing out, I'm going to go ahead and insert it. Alright, I now insert it 2 to 3 inches. I'm going to make sure the tube is over this bucket so I can collect the urine. Right, now that urine is coming out of the tube, I'm going to go ahead and insert it 1/2 inch to 1 inch further. And let the urine drain. You're doing great, Mrs. Jones. Any pain? Okay, good. I'm glad this is comfortable for you. Alright, now that Mrs. Jones has completed her urination, I'm going to go ahead and remove the tube. Mrs. Jones, go ahead and take another deep breath in and a slow breath out. As you're breathing out, I'm going to go ahead and remove the tube. Perfect. I'm going to go ahead and discard the tube in the garbage as well. And grab the urine. As I'm getting the urine, I'm going to note any odor, the clarity of the urine, the volume of the urine, as well as
And the color of the
clarity, odor,
Now I'm going to be cleaning up this area.
and volume of the urine. Right. I'm going to go ahead and set this here. Alright, Ms. Jones, I'm going to go ahead and get you all cleaned up. Now you did great. Do you feel better now that you're able to urinate? Okay, good. I'm glad. Right, I'm going to go ahead and remove this from underneath you as well. Right, I'm now going to grab my bucket and perform some peri-care. Right, dispose of that dirty linens and grab my dry towel. Get you dried up. Alright, I'm going to go ahead and get you covered back up. Go ahead and relax your legs now. Right, do you have any questions? No? Okay. Alright, let's get you back in a comfortable position. This up a little bit. There we go. Ensure patient safety. Take off my gloves.
Okay, Miss Shale, I'm going to be documenting the, I see, it looks like it's like you're doing okay. You look comfortable. Do you have any questions or concerns?
Disinfect. And then I would go ahead and document that I gave Ms. Jones her straight catheter today, as well as anything I would have noted in her urine. And go completely.
Good job.